Hello friends and welcome back to my channel Malik Helps. This is with the video about the introduction portion of the heart, and the next video will be about all the pathologies related to the heart. So stay tuned and let's see the basic portion of the heart, the introduction portion first. So let's talk a little bit about the cardiovascular physiology, just 5 lane about this. So heart contains nodal tissues and myocytes. Nodal tissues or cardiomyocytes have lesser actin and myosin. So a number of gap junction and pacemaker cells are present over there. So heart is basically is made up of the modified nodal tissues or modified myocardial tissues, which will stimulate the myocardium to contract. So heart is known for its main property as autorhythmicity. So it produces its own action potential, which travels from SA node to the AV node to the bundle of His, and bundle of His to the Purkinje fiber. Is a stimulus for the cardiac muscle to produce their own action potential. So this is the main property about the heart system. Next is pacemaker conducting system. So Purkinje fibers have the fastest velocity of conduction. This is just to understand, guys. Okay, some of the things maybe you find good to understand. So Purkinje fibers have the fastest velocity of the conduction since the gap junction and the thick fibers are there, and AV node have the slowest. So this is most common site for the conduction block, since it is having the slowest conduction. AV node ensure the ventricular filling or ventricular delay. Overdrive suppressor, let's see what it is. So if SA node is not working, the AVN will take place of pacemaker. If AV node is not working, then the bundle of His will take place of pacemaker. This is a beautiful diagram of our heart, which is showing the transmission of the impulse from the artery to the ventricular system. Next is heart sounds. So there are 4 heart sounds basically. Main is S1 and S2, but you can just hear it once if you will find it helpful. So S1 is related to the AV valve closure, S2 is related to the semilunar valve closure, S3 is related to the early ventricular filling, S4 is related to the late ventricular filling. So I made a note point here, a key note point, that S3 and S4 are not heard with normal ears, except S3 is heard in the condition hyperdynamic condition like physiological as pregnancy, pathological conditions such as anemia or CHF. In some cases or conditions of CHF, we can hear the S3 and S4 as well. However, S3 is also heard in the cardiac tamponade. So these are the things as an introduction part. I find it good to introduce these things, because maybe you are hearing these things after a long time, so might have forgotten that. So let's see how the sounds are appearing on the ECG. So on the ECG, I have mentioned the scheme here. So just after the P wave, we can hear the S4. After the R wave, we hear the S1. After the T wave, we hear S2, and then the S3. So here is a short mnemonic if you want to remember these things. So at the peak of QRS complex, you will hear S1 heard at the end of the T wave S2, at the end of P wave S4, somewhere between S2 and the next P wave S3 is heard. So S1 we all know is loud, and S2 is a bit soft, longer and short. So S1 is having less frequency, S2 is having high frequency, S1 is having high amplitude, and S2 is having lesser amplitude. Next is cardiac cycle. So a cardiac cycle includes the event that occur during one beat of heart in the duration of 0.8 seconds. So arteria and ventricle, let's see the systole and diastole timing. So arterial systole time is 0.1 seconds, diastole is 0.7 seconds, and ventricle systole time is 0.3 seconds, and diastole time is 0.5 seconds. Formula for the cardiac duration is 60 divided by heart. So cardiac cycle basically the duration of the cardiac cycle is basically having the inverse relation to the heart rate. So let's see next. Since when the heart rate will increase, when we will see some sympathetic activity system like anxiety, stress, or physical activity. Yeah. So cardiac output is simply the blood pumped by ventricles in per minute and per liter, which is calculated as a stroke volume multiplied by the heart rate, which is approximately 5.4 liter per minute. Regulation of the cardiac output. So you know the formula about cardiac output. Regulation of cardiac output, or let's say the heart rate, it is done by the sympathetic and parasympathetic system, baroreceptor reflex and brain bridge reflex. And regulation of stroke volume, it will be stroke volume is regulated with the when there is increased venous return. So it will lead to the decreased stroke volume. I'm using Frank Starling law here. So when there is increased venous return, so the end diastolic volume, so it will increase the contractility of the heart, and it will increase the afterload, so it will lead to decreased the stroke volume. Frank Starling law basically states that initial stretching of the muscle fibers of the muscle will lead to the increase in venous return will or increase in end diastolic volume. So it increase in venous return will lead to the increased end diastolic volume, and because there is more blood is coming in the chamber of the heart, and it will lead to the more cross bridge formation, which will lead to the increased sensitivity of troponin C to the calcium channels. So this is basically the Frank Starling law. No need to remember a lot about it. It's just the just for the introduction portion. So this is it with this video. I hope you understood the introduction part very well, and I'll help you to understand all of the pathologies related to the heart system in the next video, and we will discuss all the croc questions related to the heart system within one video itself. So let's wait for it. See you in the next video.